All right, let's talk about a hidden danger. One that starts silently in one part of the body and then travels to cause an absolute crisis somewhere else entirely. We're going to follow the journey of a blood clot. So, the big question is, how can a simple clot way down in your leg suddenly become a life-threatening emergency? I mean, it sounds kind of crazy, right? But the path it takes is surprisingly direct. And if we understand that journey, we can really get a handle on the risk.
Okay, so this whole process has a medical name: venous thromboembolism, or VTE for short. The easiest way to think about it is like a two-part story. Part 1 is the deep vein thrombosis, the DVT. That's the clot itself forming in a deep vein. But the scary sequel is Part 2, the pulmonary embolism, or PE. That's when things get serious in the lungs.
But why is this so dangerous? Well, here's the kicker. That first stage, the DVT, is often completely silent. You'd expect some major pain or a lot of swelling, but often there's nothing. Or it's so vague you just brush it off, and all the while this problem is building up, and you might have no idea.
All right, so before we can track this clot's journey, we got to understand what it even is. What exactly is a blood clot? And what causes one to form in the first place?
The technical term for a blood clot is a thrombus, and it's basically a solid little mass of blood cells called platelets and a sticky protein called fibrin. Your body is actually really good at making these. They're what stops you from bleeding when you get a cut, but in this case, it's like that emergency plug-forming system gets switched on inside a blood vessel, in the wrong place, at the very wrong time.
So what triggers this? How does this unwanted plug just decide to form? Well, there's a classic recipe in medicine that explains it. It's called Virchow's triad. It's not just one thing, but 3 key ingredients that mix together to create the perfect storm for a DVT. And here they are, the 3 ingredients. First up, you've got some kind of damage to the inside wall of the vein. Second, the blood flow slows way down. It gets sluggish. This is why you hear about risks with long flights or being on bed rest. And the third ingredient? Your blood itself becomes hypercoagulable, which is just a fancy way of saying it gets stickier and more eager to clot. You get those 3 things happening at once, and bam! You've got a really high-risk situation.
Okay, so the clot, the thrombus, is formed. Now, sometimes it just stays put, but the real danger, the part that turns this into an emergency, is when a piece of it breaks free and starts to travel. This is where the journey begins.
So picture this. It starts down in a deep vein in the leg. A little piece snaps off, and now it has a new name. It's an embolus, and it's on the move. It gets swept up in the bloodstream, travels up into the right side of the heart, and then the heart, just doing its job, pumps that blood and the clot straight towards the lungs. The arteries in the lungs branch out and get narrower and narrower, and eventually that traveling clot gets stuck. It creates a complete blockage, like a dam in a river.
And that's it. That blockage is the pulmonary embolism, the PE. It's the final, terrifying destination for our little traveler. And this is the moment it becomes an absolute life-threatening emergency.
But why is it so bad? I mean, what's actually happening? Well, once that artery is blocked, blood can't flow through that part of the lung to get oxygen. The pressure backs up, kind of like a traffic jam, and puts a ton of strain on the right side of your heart. The thing is, the right side of the heart just isn't built to pump against that much pressure. It can fail, leading to shock. And yes, it can be fatal.
Okay, that's the problem, and it's obviously a very serious one. So what can we do about it? How do we fight back? Let's talk about the solutions, about how medicine steps in to stop this dangerous journey in its tracks.
The #1 go-to treatment is something called anticoagulant therapy. You've probably heard of these as blood thinners. They are absolutely the cornerstone for treating both the initial DVT and the more dangerous PE.
Now, here's a really important point that a lot of people get wrong. Anticoagulants, those clot preventers, don't actually bust up the clot that's already there. What they do is stop it from growing any bigger and prevent any new clots from forming. This gives your body time to dissolve the clot on its own. Now, there are drugs that actively dissolve clots called thrombolytics or clot busters, but they're used pretty rarely for this because they come with a much higher risk of causing major bleeding elsewhere.
And just so you know, this isn't a quick fix where you take a pill for a week. Treatment with anticoagulants is a commitment. We're talking a minimum of 3 months. If you stop any sooner, the risk of that clot coming back goes way up.
So treatment is obviously crucial, but what if you never had to get to that point? What if we could stop the clot from ever even forming? That brings us to what's always the best medicine, right? Prevention.
And check this out. This statistic is pretty mind-blowing.
Somewhere between 1/3 and 1/2 of all these clot cases are kicked off by a hospital stay or a surgery. That's a huge number. And it's exactly why hospitals are so laser-focused on something called thromboprophylaxis, which is just a fancy term for actively preventing clots in anyone who's considered high risk.
And when it comes to prevention, there are basically two main toolkits. On one hand, you've got mechanical prevention. These are physical things you do to keep the blood flowing. And on the other hand, you have pharmacological prevention, using low-dose medications, like those anticoagulants we talked about, to stop a clot before it starts. So what does this look like in the real world? Well, the single most important thing is just getting up and moving around, walking as soon as you can. But it also includes really simple stuff like putting your feet up, wearing those tight compression stockings, and even using these cool devices that wrap around your legs and squeeze them every so often to keep the blood from getting stagnant.
So there you have it. We've followed this tiny clot on its dangerous journey, from a quiet start in the leg all the way to a full-blown crisis in the lungs. We've seen how it's treated, and most importantly, how it can be prevented. So I'll leave you with this question. Next time you're stuck on a long flight, or maybe just binge watching a show for hours, knowing what you know now about that slow, stagnant blood flow, what are you going to do to keep things moving?